interview of Medical Tourism Corporation Network orthopedic surgeon Dr. Oscar Oeding in Costa Rica. Dr. Oeding discussed different types of orthopedic surgeries that he performs.
I'm Oscar Oeding. I'm an orthopedic surgeon. Trained my basic training in Colombia, and now I'm living here in Costa Rica for more than 20 years. Have experience in fellowships in the United States in different parts and in different subjects also. I have now more than 10 years doing medical tourism, mostly total knees, total hips, and sports-related medicine. Hip resurfacing is still considered a temporary relief for arthritic patients. It is only a change in the femoral head surface, and the longest studies is around 8 years. So we have to choose very carefully of mild arthritic patients that don't have huge anatomical deformity. Those are the best patients for hip resurfacing. And the other ones must have a total hip replacement, which in these days things have changed so much that we are able to consider more than 25 years of a survival of the new implants. The meniscus tissue inside the knee helps for a lot of functions inside the knee. They help preventing breakdown of the cartilage. They help in the maintaining the fluid inside the knee, and biomechanically they stabilizes the knee. So they are very, very important. After a knee injury, when even knowing that there is a meniscal problem, a meniscal tear, we do have to let our patients heal by themselves. Most of the meniscal injuries heal by themselves with physical therapy, anti-inflammatory medication, maybe some changes in the sports-related activities or things like that. But when the patient does not complete the rehab with those measures, then we have to think about surgery. In surgery, we always try to do meniscal repairs, meniscal preservation techniques. Meniscal technique that we are going to use, it's an on-site decision. We have to go inside the knee, even knowing with an MRI that there is a meniscal repair. The meniscal have different parts, and depending on what part is the tear, we know if that meniscus has, it's okay, if it's going to heal or it's not going to heal. If it's not going to heal, we have to take that little part out instead of trying to repair it. All knees has 4 major ligaments: the medial and the lateral ligaments, and the cruciate ligaments, the anterior and the posterior cruciate ligaments. The ACL is the most frequent cruciate ligament injury. We are now using a quadruple tendon technique, using an autograft. That means that we take the graft from the patient. That way we are not worried about rejecting tissues or things like that. And we put that graft in the place of the ACL. Normally the patient has to take care of that knee for around 4.5 months, but they start walking 10 days after surgery. The endoscopic surgery has definitely made us see our patients in a different way, because we are now able to deal with a huge amount of problems in a very fast recovery way. For example, on knees, we do, as we have already talked about, ACLs, posterior cruciate ligaments also, cartilage problems. We can do shaving of cartilage tissue, we can do microfractures technique in cartilage tissue, or we can what we call autograft of cartilage tissue also, that we take normal cartilage from one side of the knee and put that cartilage in those sides that have problems in cartilage. In shoulders, there's even more indications of arthroscopy. We are doing shoulder instabilities, shoulder posterior or anterior dislocations. We are dealing with rotator cuff problems, partial, complete. We are doing with painful shoulders, basically, and really the endoscopic techniques has helped us a lot with these patients. We have different, as in hips, we have to choose a proper implant for each patient. We don't use the same implant in all our patients. We have to choose them. And for example, in patients with the history of a meniscal resection 10 years, 15 years ago, and we have a 45-year-old patient or a 50-year-old patient which are considered very young for a total knee replacement, we have the option of replace only 50% or 30% of that knee, only the medial compartment or the lateral compartment. And that's some implants called Oxford knees. And they have been in the market for more than 25 years. They were invented in Europe, and now we have all the technique available here, or even in the States, and it's a new option for an old problem. Sometimes what we do in bunion patients is that we take out the bunion, that's called buniectomy, and we release some tendons around the bunion that make that toe free and decreases the chances of that patient to have bunion again. In moderate to severe patients, to severe bunions, we have to cut and realign the bone, and we make like a smaller foot, and that helps preventing a recurrence of those patients. But also, it's not only a surgical problem. Also, the patients have to recognize that they will have to change their shoes style, and sometimes even the weight, because this is a shoe-related problem, and it's a weight-related problem also. The arthritic problems are not only related to knee or hips, are related also to shoulder. Shoulders is the most mobile joint in our body. So very frequently when patients have arthritic problems, shoulders are involved. The shoulder has at least two parts, the glenoid part and the humeral head part. If the arthritic problems is only in the humeral head, we only change that. That's called resurfacing. But if it is a complete problem, a diffuse problem, we need to change not only the humeral head, but also the glenoid. That's called total shoulder replacement. The shoulder resurfacing, it's even smaller surgery that we change only focalized problems in the humeral head, and we change the cartilage tissue for a metal implant. But the rest of the humeral head is still intact. We don't touch it, and good results with that technique. The patients recover full range of motion, and the pain goes away.
Medical Tourism Corporation facilitates affordable medical treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.